Hey everyone, hello from Precision Assess. Today we're jumping into a topic that honestly is way more critical than it sounds: toenail care.
It really is. We think of it as just basic grooming, right? But for the residents we care for, if it's not handled with absolute care, it can open the door to some really serious health problems. So that's our whole goal today, to give you some super clear, simple guidelines to make sure everyone stays safe.
And that really gets to the heart of it, doesn't it? Is this just simple grooming, or are we wading into some serious medical territory here?
That's the million-dollar question. And, the truth is, it completely depends on the resident and their specific health situation.
Exactly. I mean, think about it. For you or me, a little nick on our toe, we put a Band-Aid on it and forget about it, right? But for some of our residents, especially those with certain health issues, that exact same tiny cut can become an absolute nightmare. We're talking severe infections, wounds that just refuse to heal. It can get bad fast. So knowing what to look out for, it's not just good practice. It is absolutely essential.
All right, so let's get right into the most important part: what you're calling the red lights. And I love that term because it's so clear. These are the absolute stop signs, the deal breakers, the moments where you see something and you just stop. No questions asked. You do not proceed with trimming those toenails. Yep. And we've boiled it down to a simple 6-point safety check. You should run through this in your head before you even think about picking up a pair of clippers. And the rule is simple. If even one of these things is true for your resident, that's it. It's a red light. You stop.
Love that. A simple go, no-go checklist. Let's walk through each one.
Okay, so first on our list is diabetes. This is a big one. For a lot of folks with diabetes, their circulation isn't great, which means their body's ability to heal is, well, it's really slow. So a tiny cut you might not even think twice about can get infected so easily, and then it can take forever to heal. Sometimes it won't heal properly at all. The risk here is just huge. All right, next up is peripheral vascular disease. That sounds pretty technical. What does a caregiver really need to know about that?
You're right, it's a mouthful. But all it really means is that there's a major blood flow problem, specifically in the legs and feet. Think of it like a traffic jam in the blood vessels. The healing cells and the infection fighters can't get where they need to go. So, just like with diabetes, any little injury can turn into a really big problem really fast.
Now, this next one, peripheral neuropathy, this one is particularly scary. It's basically nerve damage that makes the feet go numb. So imagine this. You accidentally nick the resident, but they can't feel it. There's no pain. They have no idea they've been cut, so they can't tell you. And an infection could be brewing down there for days without anyone knowing, until it's become a massive problem. Wow, that's a scary thought. Okay, number 4 on the list is anticoagulant therapy.
Right, which is just a fancy way of saying the resident is on blood thinners. And what that means is their blood has a really hard time clotting, so even a nick that seems ridiculously small, I'm talking a tiny little scratch, can lead to some really serious bleeding that's tough to get under control.
And then, beyond those medical conditions, there are the red flags that you can see with your own 2 eyes. Just take a good look at the nails and the skin around them. Are the nails super thick and tough? Do they look kind of yellowy or brittle? That could be a fungus. Is a nail digging into the skin, an ingrown toenail? See any of those? You stop. And this should be obvious, but if you see any kind of open wound, a sore, or even just some redness or swelling, that's an automatic do not touch. Okay, so you've done your check. You've spotted one of these red lights. The clippers are down. What's the very next step? Well, it's simple. You call in the experts. And this is all about understanding the roles, right? It's about staying in your lane to keep everyone safe. The caregiver's role is so important. You are the eyes and ears. You're the one who's monitoring the feet every day, reporting any changes, and maybe doing some gentle filing if the care plan says it's okay. But the minute we're talking about diagnosing a problem, treating something, or, and this is the big one, actually cutting the nails of a high-risk resident, that is a job for a medical pro, a podiatrist, a nurse, period.
And that's exactly why we have formal processes in place. They're not just bureaucracy, they're there to protect everybody. Here in Washington State, for example, we have the Nurse Delegation program, which is designed to do exactly this: draw really clear, bright lines so that every caregiver knows precisely what they are legally and safely allowed to do for each specific person in their care. Right. We've spent a lot of time on the stop signs, the don'ts, but it's just as important to talk about the green lights.
Because we really want to empower caregivers. There are so many safe, positive, and incredibly helpful things you can and should be doing to support great foot health. So what does that look like? What's on this safe to-do list? It's really all about that proactive, preventative care. Things like gently filing nails just to keep them smooth so they don't catch on anything, washing and drying feet really well, and I mean getting in between every single toe. But the absolute number one thing is just looking, making daily foot checks a part of your routine. You're looking for any little change in color, temperature, the skin, anything. And if you spot something that looks off, you report it and you document it immediately. These simple actions, they are beyond valuable. You know, all of this really points to one big thing, doesn't it? To avoid any confusion or dangerous mistakes, there has to be one single official rule book for every resident.
And there is one. It's the care plan.
The care plan is everything. It's your North Star, your playbook, your single source of truth. This is the official guide put together by a nurse that lays out exactly what care is safe and approved for that one specific individual. When it comes to toenails, it needs to be crystal clear. Can a caregiver trim them or not? The answer has to be right there in black and white. I absolutely love this quote here because it just nails it. The care plan isn't just paperwork, it's your most important safety tool. That's the bottom line. If the care plan doesn't say you can do it, then you don't do it. It really is that simple. And that's really the magic of a good care plan. When it's clear and detailed, it takes all the guesswork out of the equation. It's a shield. It protects the resident from getting hurt, and it protects you, the caregiver and the provider, from liability. There's no confusion. Everybody knows exactly what their job is. So this really leaves us with one final, crucial question for you to think about right now. Go through your residents in your mind. Is their care plan so clear, so unambiguous, that it could prevent a dangerous mistake with something that seems as small as toenail care? Is it that clear? And look, if your answer isn't a confident 100% yes, that's okay. But it is a sign that it's probably time for a review. For any of our providers in Washington's adult family homes, if you need a hand with care planning, with nurse delegation, or with assessments, please don't hesitate to reach out to us at Precision Assess. That's what we're here for, to help you make sure you're providing the absolute safest care possible. Thanks so much for joining us.